Okay, finally, module 7, I'm going to discuss what patients should know. Now, my advice to patients is to understand quite often intravenous access and iodinated contrast is a necessary part to get a adequate study. So sometimes patients come in and they've been told that they don't need an IV. That might be true, but after discussions, usually with the referring doctors and the radiologists themselves looking at the clinical conditions with patients might escalate that to IV injections. So first and foremost, a patient should not be terribly alarmed by that. That does happen. Now, it's important that the patients inform the staff, if it's not already a routine screening structure, what kind of medications you're taking. Some medications may interfere with the study. To give an example, metformin, which is a oral diabetic medications, sometimes can precipitate, rarely, but it can precipitate lactic acidosis in the administration contrast. Some other use, such as nitroglycerin, might be contraindicated in a patient who is taking Viagra or other vasodilator. So you need to make sure that the staff knows what kind of meds you're taking. Now, generally, you will have some concern about radiations and IV contrast agents. It is imperative that you talk to the staff to get an understanding what kind of radiations that you're getting, what does that mean, what kind of contrast you're getting, and what could happen to you. And all this has been discussed earlier in the previous modules. Do you let the staff know immediately if you develop any unusual symptom? It could be minor things, it could be major things. It could be as small as coughing, but it could be difficulty breathing or rash beginning to develop. And that might be the earliest indications that you have a reaction to the contrast. And we have to execute the appropriate management after that. And if you do receive intravenous contrast, I advise you to keep up oral hydration. Usually I tell them to take 2 liters of fluids. It could be electrolytes type of fluid, but it doesn't have to be. It could also be just simple water. And the reason for that is keep up the hydrations and as the renal excretions take out those water, it will carry with it all the contrast that we have to administer. I will keep that hydration up for 24 hours.